Hi, folks. Thanks for downloading this edition of the NACCHO University podcast series. I'm Ian Goldstein. Today, we're here to talk about evidence-based public health and how evidence-based public health can help local health department leaders and staff make connections between research on effective health promotion strategies and the specific needs of the communities they serve. NACCHO's new Resource Center for Evidence-Based and Cross-Sector Approaches offers a three-step framework that local health departments can use to implement evidence-based public health. Brandie Adams is with me today, and she is an MPH Senior Program Analyst at NACCHO, and she is the developer of the NACCHO resource and serves as the evidence-based chronic disease prevention subject matter expert at NACCHO. And today she joins us to talk about how evidence-based public health can be administered by local health departments and tools featured in the Resource Center. Brandie, welcome. Thank you so much for joining us.
Thank you, Ian.
You know, I think many public health practitioners think of evidence-based public health as important, but when it comes down to it, many local health departments are struggling to implement it. Can you tell us why that is?
I think you're right that there is a general sense among local health departments that evidence-based public health is important, particularly since many are required to implement evidence-based interventions to get federal funding. But the difficulty related to implementing evidence-based practice stems from three primary issues. There, on some level, is limited awareness of what it means to implement evidence-based practice. There are also workforce capacity issues and misconceptions and stigma about evidence-based public health.
Right. And so what are some of those misconceptions or the stigma that comes with that?
Well, based on research that NACCHO conducted with local health departments, we've learned that many public health practitioners think of evidence-based public health as academic and difficult to implement and very time-consuming. They've also reported that implementing evidence-based public health interventions can limit the creativity when it comes to developing new intervention ideas and engaging community members.
Yeah, and what kind of limited awareness?
Well, evidence-based public health is a pretty abstract term that encompasses a lot of different things. And on top of that, you have a huge number of public health planning frameworks and guidance documents like the National Prevention Strategy, which grows out of the Affordable Care Act, and the Community Health Improvement Planning process that local health departments are required to implement in order to get accreditation. And so it can sometimes be difficult for practitioners to figure out how and when to integrate evidence-based decision-making into those frameworks.
And can you explain why it's important for local health departments to prioritize evidence-based public health?
I think that there are two primary reasons. One is evidence-based public health is a solution to the shift in the financial climate. As you know, many local health departments have suffered budget cuts, and the use of evidence-based approaches can increase the perceived importance of investing dollars in public health to make the case for prevention.
Well, can you give an example of that?
Sure. So based on research from the CDC, we know that one workplace smoke-free policy can prevent 1,500 heart attacks and 350 strokes per year, and also save $55 million in direct medical costs.
Right.
So if you can imagine what would happen if every health department did just one of those things, the cumulative impact it could have in making visible the value of public health.
Right. Well, those are good points. So let me ask you, how do you define evidence-based public health, and how should it be delivered by local health departments?
Well, at a very basic level, evidence-based public health is simply using strategies that we know have been proven effective. A more formal definition that we use at NACCHO is a process of integrating similar elements across multiple public health decision-making and planning approaches using the best available evidence to implement strategies that work and align with community preferences. How local health departments can implement evidence-based public health is to turn to a resource that we've developed called the Framework for Evidence-Based Decision-Making and Planning, which guides how local health departments can integrate evidence into their community health and improvement planning efforts. And that framework builds up on the EdCHIP model, which stands for Evidence-Based Community Health Improvement Planning, developed by Lade and colleagues, and also the model builds upon key evidence-based public health tenets and action steps as defined by Bronson and colleagues.
So what are some key activities that local health departments can implement to carry out evidence-based public health?
The key activities that NACCHO recommends local health departments implement are founded upon Bronson's model for evidence-based public health. So some key activities include community engagement and assessment, use of theory and planning new interventions, considering and prioritizing interventions based on peer-reviewed evidence, evaluation and data collection, and dissemination of evidence-based approaches. From an organizational perspective, which is based on research that NACCHO conducted with local health departments, it's important for local health department leaders to implement activities that foster an agency culture that is supportive of evidence-based public health. They can work to implement policies and procedures that help institutionalize evidence-based public health into the routine planning and evaluation practices of their agency, and also ensure that staff are trained to develop key competencies for public health.
Okay, well, that sounds like a big undertaking. So, which brings me to a point you made earlier about the perception that evidence-based public health is time-consuming and difficult to implement. How can local health departments save time planning and carrying out evidence-based public health?
Well, I think that it sounds like a bigger undertaking than it actually is, because many local health departments are already implementing many components of evidence-based public health.
Right.
They are routinely engaging community partners in planning and implementing community assessments. They're working with those partners to plan and implement interventions, and they're also carrying out evaluation to collect data to help them ensure that their strategies are effective. Where I think local health departments can focus is to ensure that staff are trained on how to find, review, prioritize, and customize evidence-based interventions so that they can best meet the needs of their communities, and also find ways to make the case for the use of evidence-based interventions.
Now, where's a good place to start?
A good place to start is to consult your community health improvement plan and review your assessment data, and then to take that data and use it to develop a problem statement which outlines opportunities and priorities for prevention, and then use that problem statement to frame a review of the literature so that you can identify appropriate evidence-based approaches to carry out priorities. And then once you have a listing of possible interventions to use, you can make comparisons among them using considerations of cost, feasibility, and fit, and then lastly map out a action plan which serves as a blueprint for implementing the approach.
Right. Now, I'm sure there are resources and tools also that local health departments can use.
Yes, there are a number of tools that help streamline the process of evidence-based public health available in our new Resource Center for Evidence-Based and Cross-Sector Approaches. You can find action planning templates, train the trainer programs, success stories, and a screencast series that outlines 6 steps for carrying out evidence-based public health.
So it sounds like a lot of the groundwork has been laid and resources are out there, but how do local health departments make the case for implementing evidence-based interventions when their communities want to implement their own ideas?
Well, I think that ideas about community intervention should come from communities. And evidence-based public health doesn't simply mean just using interventions that have already been tested, but it means that if you are going to implement a new intervention idea, that you should consult the literature to find out if that approach has been done before, how it was done, and what worked, and then also develop a solid evaluation plan so that you can collect data about the new approach to work toward building a new body of evidence that is documented well enough so that others can replicate your findings.
Mm-hmm. So are there any tips for listeners about how to make the case for evidence-based interventions to community stakeholders?
I think that local health departments can work with communities to identify champions who have been positively impacted by evidence-based interventions, and that those champions can share stories about how they've been positively affected by the interventions that they've participated in. It's also important to focus on the benefits of various evidence-based approaches outside of health status. For instance, chronic disease self-management programs is an evidence-based approach that we know can help people manage their chronic conditions, but it's also proven to change people's quality of life and helping them deal with difficult emotions resulting from their chronic conditions. And that is a benefit that is very attractive to many community members. You can also use infographics to easily communicate data to show impact of evidence-based interventions. And I think it's also important to, if you are going to use pre-tested interventions, to engage stakeholders in the selection of those interventions. And again, I would recommend that practitioners turn to the EdChip model and NACCHO's evidence-based decision-making framework for ways to have those discussions about evidence with community members.
And where can they find that?
They can find that in our resource center,
Okay.
which chronicles lessons learned from a cooperative agreement with CDC about how local health departments are implementing evidence-based public health. And that resource center offers an interactive framework that takes users through action steps alongside helpful tools and resources. And that can be accessed at www.ebprevention.org. There's also a subsite with a link to a community guide toolkit, which is a resource for evidence-based practice, and that URL is www.ebprevention.org/CG.
Well, those are a lot of great resources for evidence-based public health, and I'm sure our listeners will get a lot out of that. So, Brandie Adams, thank you so much for coming in today.
Thank you for having me, Ian.
So that was our talk with Senior Program Analyst from NACCHO, Brandie Adams, talking about evidence-based public health. Thank you for downloading this edition of the NACCHO University podcast series. To download more of our podcasts, please check out our website at www.naccho.org/university.